Implantable cardiac defibrillators as a part of the 3-minute series. Implantable cardiac defibrillators are life-saving devices. They monitor the rhythm of the heart and deliver a shock when needed. This is commonly used and a proven technology and safe to implant in all age groups. The battery life is fixed of the generator and it needs replacement after it is drained. It is very important to implant these devices in patients who have a history of cardiac arrest, patients who have a history of ventricular arrhythmias, and patients in whom there is pumping of the heart less than 35% with symptoms of heart failure. Importantly, it does not improve the pumping of the heart and merely protects against sudden cardiac arrest. In this device, you have just one wire which is present in the heart. Typically, this wire has a coil and then the whole wire is connected to a generator. Now, this wire has a small screw to hold it in place within the heart, and the generator is placed below the collarbone, underneath the skin. This procedure usually takes about 1 to 2 days of hospital stay. Blood thinners will be stopped as per doctor's advice prior to the procedure. Procedure is just under local anesthesia and lasts for about 1 to 1.5 hours. The mobilization of the patient is near immediate after the procedure and recovery takes 2 to 3 days. The wound heals well after the surgery and it is generally depending on the immunity of the patient. For the first 2 weeks, we keep it under dressing and later on it is kept open and dry. The blood thinners are to be restarted only after the doctor advises, and the arm on which side the device is implanted should not be lifted above the shoulder for 6 weeks. The visit schedule post-procedure is very fixed, and prior to every visit, one needs to get an ECG, meet with the heart failure expert, and check the device prior to visiting with the electrophysiologist every visit. The heart failure medications will continue even after the implantation of this device. Once this device is implanted, one does not want to go into areas where there is electricity generation, where there is a high arc welding setup, or where indulge in activities that involve drilling. Mobile phones are preferably used on the side opposite to the side of the ICD. If a shock is felt, one should visit the hospital immediately. One preferably should keep an ID card or an ICD card on them. Airport visit and air travel remains safe. Please let us know in your comments if you have any other questions. Thank you.